Medical emergencies can occur at any time and in any healthcare setting. As a certified nursing assistant, it is crucial to be prepared and equipped with the knowledge and skills to handle these situations effectively. This section will cover various medical emergencies that CNAs may encounter and provide guidance on how to respond appropriately. Recognizing medical emergencies. The first step in handling a medical emergency is recognizing the signs and symptoms. As a CNA, you will often be the first to notice any changes in a patient's condition. It is essential to be vigilant and aware of the following indicators that may suggest a medical emergency: sudden and severe difficulty breathing or shortness of breath, chest pain or discomfort, unconsciousness or altered level of consciousness, seizures or convulsions, severe bleeding or injuries, signs of stroke, such as facial drooping, slurred speech, or weakness on one side of the body, allergic reactions, including difficulty breathing, swelling, or hives, choking or difficulty swallowing, changes in vital signs, such as a rapid heart rate or extremely high or low blood pressure. Immediate actions when faced with a medical emergency. It is crucial to remain calm and take immediate action. The following steps should be taken. Assess the situation. Quickly evaluate the scene to ensure your safety and the safety of others. Identify any potential hazards or risks that may hinder your ability to provide care. 2. Call for help. Activate the emergency response system by dialing 911 or following the facility's specific protocol. Provide clear and concise information about the situation, including the patient's condition and any relevant details. 3. Provide initial care. If the patient is unconscious or not breathing, begin cardiopulmonary resuscitation, CPR, immediately. If the patient is conscious but experiencing severe pain or discomfort, provide reassurance and support while waiting for medical professionals to arrive. 4. Follow specific protocols. Different medical emergencies may require specific actions. Familiarize yourself with the facility's protocols for handling emergencies, such as administering an epinephrine autoinjector for severe allergic reactions or using an automated external defibrillator, AED, for cardiac arrest. Common medical emergencies. Cardiac arrest occurs when the heart suddenly stops beating. It is a life-threatening emergency that requires immediate intervention. If you witness someone experiencing cardiac arrest, follow these steps. Call for help and activate the emergency response system. 2. Begin CPR by performing chest compressions and rescue breaths. Follow the guidelines provided by the American Heart Association or your facility's specific protocols. 3. If available, use an AED to deliver an electric shock to the heart to restore its normal rhythm. Continue CPR until medical professionals arrive and take over. 4. Respiratory emergencies. Respiratory distress can be caused by various factors, such as asthma, pneumonia, or an obstructed airway. If a patient is experiencing difficulty breathing, take the following steps. 1. Stay with the patient and provide reassurance. 2. Help the patient assume a comfortable position, usually sitting upright. 3. If trained to do so, assist the resident with any prescribed inhalers or medication. 4. If the patient's condition worsens or they become unresponsive, initiate CPR. Seizures can be frightening for both the patient and those witnessing the event. If a patient has a seizure, follow these guidelines. 1. Clear the area around the patient to prevent injury. 2. Do not restrain the patient or put anything in their mouth. 3. Protect the patient's head by placing a soft object or pillow underneath. 4. Time the seizure and observe any changes in the patient's condition. After the seizure, provide comfort and reassurance to the patient. 5. Allergic reactions can range from mild to severe, with anaphylaxis being the most severe form. If a patient is experiencing an allergic reaction, take the following steps. 1. Identify the allergen and remove it from the patient's environment if possible. 2. Administer any prescribed medications, such as antihistamines or epinephrine, according to the patient's care plan. 3. Monitor the patient closely for any signs of worsening symptoms. 4. If the patient's condition deteriorates rapidly or they develop signs of anaphylaxis, call for emergency medical assistance and be prepared to administer CPR or use an AED if necessary. Documentation and reporting after a medical emergency. It is essential to document the incident accurately and report it to the appropriate healthcare professionals. Documentation should include date and time of the emergency, description of the events leading up to the emergency, actions taken during the emergency, including any interventions performed, patient's response to the emergency and subsequent care provided, any changes in the patient's condition following the emergency. Reporting the incident to the healthcare team ensures that the patient receives appropriate follow-up care and that any necessary. Remember, handling medical emergencies requires both knowledge and regular training, and staying up to date with the latest guidelines and protocols are essential for providing the best possible care in these critical situations. Please proceed to the